concerned with economic ramifications from COVID-19 versus the protection of all of its citizens. And I know that sounds like a terrible statement, but it's very much true. And so, as in other pandemics, and as in other things, viruses that has hit our nation, oftentimes African Americans are left to pick up the pieces and fend for themselves. And so, what we want to do is begin to have a conversation. But before we go into our conversation, I want to introduce our panelists to you. And when I call your name, panelists, just for the sake of time, introduce yourselves, give us a little background, and tell us a little bit about your profession, where you're from, and things of that nature. And so we're going to start with Dr. Kwinda Johnson. If you would please introduce yourself to the people. Dr. Kwinda Johnson.
How are you? How are you? First of all, I'll have to correct Bishop. I am actually a physician assistant, which is a mid-level provider, somewhat like a nurse practitioner. But I've been doing it for about 20 years. So I feel like some days, if I'm really on a good level, I am a physician for all intents and purposes. Physician assistants can prescribe and they see patients independent. I've been doing it for about 20 years. I'm a graduate of Howard University Physician Assistant School, one of the oldest PA schools in the country. Let's give it up for Howard. And I currently work in urgent care medicine.
All right, welcome, 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 and thank you so much. Please forgive me.
Oh no, it's quite all right. It's a common mistake.
Oh no, my sister's a PA,
Okay.
and people refer to her as doctor,
Yeah.
and so I know you all do the bulk of the work. Trust me.
Right, definitely
Thank
some
you
of the
so
heavy lifting for sure.
Oh, of course. Thank you for joining us.
For sure.
Next, our next panelist is pastor or prophet Njeri Kamari.
Greetings, everyone. How are you?
Greetings.
Greetings.
Can you hear me? Just one.
Yes, we can hear you quite well.
Awesome. Hey, yes, I am Pastor Njeri Kamara. Some people do say prophet. My ministry is In Christ Ministries. I am a spiritual practitioner. I also work with women and children and showing and teaching them how to be reconciled to themselves and know who they are. I also do holistic ministry. I've been in ministry now for well over 30 years. I've been doing it full time on my own now for about 18 years. I truly believe that we are much greater than we give ourselves credit for. And I'm looking forward to the conversation at the table about how we can incorporate some just natural, holistic things into our lives so that we can stay safe and stay encouraged and stay positive during this time. I live in Memphis, Tennessee. I did about 16 years of the ministry in Atlanta. So I do have a lot of followers in Atlanta, and hopefully they're all on and listening. And let's start the conversation.
All righty. Thank you so much for joining us. Next, we will have Pastor Valerie Oliver.
Greetings, everyone. It's a pleasure to be here this evening. I am founding pastor of First Liberty Baptist Church here in Baton Rouge, Louisiana. I said Baptist, but we are not your typical Baptist church. So we are an all-inclusive Baptist church. I am a licensed mental health therapist as well, and I work with children, adolescents, and adults. My favorite group is adolescents. I just love their grown hearts. They think they know it all, and I love working with them. I have seen some stuff here lately, but it's a blessing to me to be a blessing. And I've been practicing private practice for about 16 years now. I've been licensed for 27 years. And I am delighted to be here. Hopefully I can shed some light on some of the mental health um, issues that we're having in our community. And I'm glad to be here.
Thank you, and we're glad for you to be a part of the conversation. Thank you so much. And next we have Pastor Tonya Hatton.
Good evening, everyone. My name is Tonya Hatton. I'm founder and senior pastor of the Gathering in Columbia, South Carolina. I have worked in higher education since 2007. I have most recently picked up my third master's in, I don't know what happened to the camera, my third master's in social work. I currently now work in substance abuse. My specialty is definitely working with millennials and youth and adolescents. And I'm honored to be here tonight to join in with this discussion.
All righty. Thank you so much. Thank you, thank you, thank you. All righty. And last but definitely not least, we have Keisha Waites. Uh-oh. Keisha Waites, are you with us? Okay, well, we may be having some.
Bishop Keisha Waites should be coming in now.
Bishop, can you hear me now?
Yes, we can hear you. How are you?
Okay, I am terrific. Thank you so much for the opportunity to join you this evening. How is that?
Yes,
Okay.
I'm good.
Thank you so much for the opportunity to join you. I have spent about 15 years as an emergency manager. I served with the federal government, the Federal Emergency Management Agency for a number of years. Very quickly, in lieu of time, I also had the privilege of serving 3 terms in the Georgia House of Representatives. And so COVID-19 has certainly been a disruption. I have a sibling that actually contracted the virus. And so it certainly has impacted my life personally. And I look forward to the conversation tonight.
Welcome, welcome. Thank you for being a part. Thank you so much. So we want to just jump right in. As I said, we majority are living in the southern states on this panel. And I know that we have representation from Louisiana and just different parts in the South region. And what we're noticing is an eagerness for our states to reopen. Oftentimes, we've heard our governors and officials say things like, you know, we can't just let the economy collapse. We hear them say, I heard of the Texas governor saying, y'all know I'm very real and laid back. So I'm just going to make it very comfortable for us to have a conversation. The Texas governor said, how did he put this? I want to get it correctly. He said that the elderly should feel privileged and honored to die to save the country and the economy for the younger people. Mm. That's a literal quote from our governor in Texas. And so,
Wow.
We know that the South, those of us who are natives of the South, we understand the underlying messages to things like that. We understand that the South hasn't changed much. It's, you know, we've made some progress through blood, sweat, and tears, but there's still ideas that are present in the South that would suggest that anyone other than Caucasians, affluent or economically empowered Caucasians are not important. Most people are very much disposable in the sight of some of our white counterparts. And so I want to have a conversation of how this pandemic has strategically targeted African Americans. Also, things that we can do Because as I said, we have to save ourselves. Nobody's coming to save us. And if we haven't gotten that message loud and clear through the other pandemics and viruses that have hit our nation, we should be clear about it by now. We really need to put some things into practice that will enable us to better withstand the disparities that hit us because of these pandemics. So anyway, I'm going to go right into it. The first question I have is for Valerie Oliver. Valerie Oliver, before I start rambling too much, I know I'm a rambler. Valerie Oliver, in light of COVID-19, the NAACP recently released a report warning that the byproduct of this pandemic in African American homes especially would inevitably see a substantial increase of abuse, domestic violence, depression, substance abuse. And because schools are also closed, we're seeing the numbers dealing with child abuse escalate. And so I want to ask you, what advice can you offer us? What advice can you offer our people to help minimize these devastating residuals of COVID-19? The things, we look at the disease, we look at the numbers, we look at the health effects, but we don't look at the residuals, the things that happen, the byproducts that happen because of COVID-19. So what are some things that you can offer us, some type of self-help, some type of pointers that you can give individuals to help manage their emotions, to help manage their mental health while they are yet still sheltering in place? Because clearly for people of color, we may need to shelter in place a little while longer. And so what can we do to ease some of these things that are happening in the homes as a result of COVID-19 and having to quarantine and shelter in place?
Well, what we like to do as mental health professionals, we try to encourage people to be informed, to get facts, stay away from so much social media. Some of it may be true, some of it may not be true, but you get your information from reliable sources such as the CDC, the Center for Disease Control, World Health Organization, or WHO. Here in Louisiana, the Louisiana Department of Health. You want reliable information so you know that you're dealing with the truth, you're dealing with the facts. Because when we know the facts, it can help us to determine how we are at risk. It helps us to understand how we can work with our healthcare providers, meaning physicians, nurses, their PCPs, and take the necessary precautions to help themselves. But a lot of us don't watch the news. We don't read very much, go to these websites to WHO, the World Health Organization. We don't really go to CDC. We don't pay attention. We listen to Instagram and Facebook and people putting out all this, false information, and it just raises levels of anxiety. And it raises fear. So if we would just know the facts and go to reliable sources, because this is a time of uncertainty. And when you know the facts, it can reduce anxiety. It can reduce levels of stress. When we don't know the truth and we're hearing all this stuff, we're hearing something from here, we're hearing something over there, we're hearing something there, then we start having a lot of what if questions, and well, what if, this happens? Ooh, they said they've been hearing about this, they've been knowing about this, and, well, that may be true, but know that you got it from a reliable source. And so we don't want to increase people's level of anxiety. We want to reduce it. you know, and so some people, believe it or not, even though we say that, are afraid to know the facts. And a lot of us, I'm so glad that we, you know, as a people are moving away from whatever happens in the family, stay in the family. You know, you don't talk about that. You don't, we can handle it by ourselves. You know, you don't need to see a counselor. You don't need to talk to anybody. You know, I'm so glad that we have moved away from that, and people are seeking help in the African American community. And I'm so glad that you know, people are doing that. But some people just don't want to know. They don't want to know, you know, the truth. They don't want to be tested because they don't want to be found positive because they're afraid.
Let me ask you, I'm sorry to interrupt, but I want to ask you, so what do we do for that person who already has the diagnosis as being, you know, having some type of mental chemical imbalance, some type of mental illness going on? And they're unable because, you know, a lot of the doctors' offices were closed, and you know, how does that person get help when they're feeling like they're in crisis? What can they do is there anything they can practice at home? Other than, I mean, yes, we want to definitely have the facts, and we want to make sure we're getting our facts from a reliable source. But what does that person do when they're in crisis or feel as if they're going to have an episode? You know, in the news in Milwaukee just this week, there was a man that annihilated his family. He killed 5 members of his family, and he did have a history of mental illness. He also had a history of domestic violence, you know, with his past partners, and some child abuse as well. So that I don't think he just woke up that morning and said, let me kill all my family. You know, I believe there are some things that contributed to his level of anxiety or stress or triggered his depression of some sort. So what should we do? What can that person do?
Well, we have offered telehealth of all of the restrictions abroad because there were strict restrictions on telehealth. You couldn't just, you know, get on video and say, hey, I can help you using telehealth. You have to go through training and all this kind of stuff. But those restrictions were relaxed so that more people would have access to mental health professionals right at their fingertips on their phone. If you have a phone, you can access help. You can either call or you can get on the video. We use Zoom, such as we are now. We use WebEx. All of my clients are on Zoom or WebEx. And I am working from home on a daily basis, a full caseload every day. And so they have access to mental health therapy. So, and it's not just the state of Louisiana. Usually the guidelines are per state, but now it does not matter where they are. Usually, you know, I can only talk to someone who lives in Louisiana, but now I can help somebody in Florida. I can help somebody in California. I can help somebody up in Washington. I can help anybody, and everybody has access to help wherever they may be. And so they have relaxed, you know, and so at home they can do a lot of different practical things at home besides picking up the phone and calling for help. They can exercise. A lot of times exercise will do wonders for stress and anxiety. You can get on YouTube and find, you know, videos and just work out. We tell people all the time, get an exercise routine. Exercise. If it's just walk around your backyard, you know, walk around, find hobbies. Do things that you enjoy doing, you know, keep a positive attitude, you know, don't just always look at the worst, because anxiety will always take you to the left, take you to the worst, you know, outcome. You always think the worst. And so we encourage people to think positive. What is the good, that you can find? So we try to reconstruct the thoughts to stay positive, and exercise, eat right, get a hobby, do some new things, set some goals for yourself, and just be positive. Take care of yourself.
And is there any way that you can list some of those resources you were speaking of, some of those teletherapists and things like that? Can you list some of those in the chat for us so that our hosts can take those and share them into our Facebook Live and different places? Because we want to make sure that people know that help is there. Sure. And we certainly appreciate that. And that was some good information. Find alternatives to anxiety, because even people who have not been diagnosed with mental illness or things like that are experiencing some anxiety, Yeah. And I mean, we're human, so things touch us and affect us. Thank you so much. Thank you so much.
You're welcome.
All right, Kwinda PA. So I want to talk to you a little bit because what we're seeing in the South, we're still seeing an escalation of COVID-19 cases. I believe within a 24-hour time period, we had over 1,000, I believe the number was 1,217 cases within new diagnosis within 24 hours. That's crazy. And that was after Governor Kemp opened the state. So
that provides proof positive that we need to isolate as much as we can.
We need a shelter in place. So I want to talk to you a little bit about that, especially as it concerns African American people, because we make up the majority of these cases. And that statistically, many people of color are already physically challenged with, high blood pressure and obesity and diabetes, things that affect, our people. And so staying at home and self-quarantine, it could have devastating effects on people who are already suffering from who are already challenged with these issues. A lot of people are staying at home and they have sedentary behavior and they, low levels of physical activity and things like that. And we know that can also contribute to worsening COVID if you happen to contract it, or just simply it can worsen the underlying health issues that we already have. Right. So I just want to, ask you as a healthcare professional, can you speak to some of the challenges that we have, some of the unhealthy behaviors that we seem to practice, and if there's anything that we can implement in our daily schedule, daily routine while we are in quarantine that can kind of change this narrative for us, and that can also offer us maybe some preventative measures, make us more resistant to contracting this disease.
I think that there are several things that we have to consider. We have to consider the economic factors when we are thinking about being as healthy as we can, right? And so the vast majority of us are working to some extent in jobs that are serviceable, especially in the South, correct? The South is full of at-will states, and they can let you go if you don't comply to what the state has to say. However, if you have access to medical care, one of the big things that you can advocate for yourself with in regards to that are if you have any pre-existing conditions, and you can look those up quite easily on cdc.gov. We in the medical community have decided we are going to get our information from one source in regards to this pandemic, and that is cdc.gov. And that is quite easy to access, as well as it speaks in plain language.
Can you repeat that, please?
cdc.gov.
Oh, CDC, okay.
Right, and they're located there in Atlanta. Yeah. And so if you have questions in regards to if you can seek care through your doctor that allows you to continue to remain at home, There's an act in government that's called Family Medical Assistance Act, FMLA. We all have most of us have heard of that if you have health insurance in this disjointed system. And so if you have asthma, if you have diabetes, if you have any condition that lowers your immune system, which the list is clearly listed on cdc.gov, you can contact your family physician, physician assistant, nurse practitioner, and you can receive and should receive quite easily without resistance letters, and you can fill out FMLA paperwork so that you do not have to report to work, and they can reserve your job. You cannot be fired for FMLA completed paperwork. And guess what? We are completing all those things online. I haven't been to work in a month, but I've been treating patients every day telephonically, right? We have a part of our clinic that has patients come in if they're in a critical situation in family medicine, but those are rare. We're probably seeing less than 30 patients a day in the clinic. But if you need something from your family physician, you can get it right now. Okay, you can get refills. Many of the things are much more lax in regards to you haven't been in to have your blood pressure checked, or you haven't had blood work or any of that. If you're 70 and over and you haven't had blood work in 3 months, don't get it for another 3 months. You don't need it right now unless something has changed. Do not go to the clinic. That's where you will catch corona, because those viruses are being housed and being seen at hospitals and emergency rooms and those types of things. All right. So make sure you advocate for yourself medically when it comes to FMLA paperwork, filling out paperwork that says you have a pre-existing condition and you do not have to work right now. When it comes to that, your doctor's office should be free and clear in regards to giving you those definitions and things that you need to fill out your paperwork if they've seen you before and they prescribe you medications on a regular basis. Also, the cdc.gov is a great resource for if you think you have symptoms. Okay. So you can go on there. There's a clear list. If you're having shortness of breath, chest pain, fevers, sweats, chills, body aches, it could still be influenza, which still kills 60,000 people every year in America alone. I know there's debate about the flu shot, but come on now. The evidence is there. Anyway, if you need prescriptions refilled, if your doctor doesn't allow you to get those refilled quite easily right now with minimal hubbub, get a new doctor. Okay, because that's a problem. Your pharmacist, if you need to change it to a pharmacy that delivers or has a drive-through window, do so. CVS is delivering now. They didn't used to really do that. So especially if you're 65 or older, don't go out of the house. And if you have to, please make sure that you have on a mask. I wanted to show you all my mask. All right, it was made by some little kids at our local elementary school, but you have to either put a coffee filter or a regular mask in it. Even though I have 2 layers to my mask, please make sure you have something in it that actually has tight weave and blocks droplets, which is how corona is spread. In regards to your eating habits and in regards to your exercise habits, Ms. Oliver mentioned exercise. Oh, the benefits. And like I said, I've been doing this for 20 years. And the main thing people say is, I don't have time to cook right or exercise. Well, now, yes, you do. All right. You can order vegetables to your home. Most of the grocery stores are not charging for delivery. You still don't have to go out of the house, but now you have the opportunity to do something that matters more than anything else, is to cook for yourself. Okay, and incorporate vegetables and things that require a little bit more time.
Let me interject for a second, because you raised something very important. You were speaking of, things like ordering medications and being able to get prescriptions for 90 days at a time, and being able to order food to your home and things like that. And those are definitely things that we can take advantage of during this time. But what would you say to that person? I saw where someone just asked a very important question. They said they just started work 6 months ago, and so their benefits did not kick in. And there are people who are struggling financially at this time.
Of course,
You know,
of course.
what are some things they can do, while having to shelter in
Sure.
place, stay at home, to stay healthy. They may not have
Sure.
opportunity to order food in, or
Sure.
pick out the most healthy vegetables. And if
Sure.
you know anything about the South, we have neighborhoods where we just simply don't
Food
get the
deserts.
produce in, and things of that nature. So do you have any advice for that person who may be struggling in that way?
For sure. A lot of times we can't buy fresh, right? So the next step is frozen. All right. And they still have the steamables and those type of things. And they're much cheaper. And some of the science says that they are better because they're flash frozen before they lose lots of their nutrients. So start with frozen vegetables. We in the African American community, and I worked in the South for a very long time, we still use a lot of canned vegetables and those type of things. Please take those off of your list, all right? Unless you just absolutely don't have another option. Make sure also you put yourself on a schedule. So you are scheduling meals less frequently, but those that are as calorie dense as you can as far as nutrients, not those carbohydrates and those processed foods. For the last 3 years in the United States, groceries are more commonly bought at the dollar store than the actual grocery store. And that's probably because of our finances. Try to avoid that as much as you can. If you have to do it that way, lean towards anything that you can find that has a greater vegetable content and a lower sodium content. We as African Americans, if you have time, you can look up the Middle Passage. We are very sensitive to sodium, and that is in all processed foods, sodium, fat, and sugar. Everything in the dollar store is packed with that stuff. Don't eat food from there if you just can avoid it.
Okay. Thank you. Thank you so much. Now, what would you say to that person who may not have may not have insurance or enough insurance, that would be in need of medicines and things like that? If they were to contract COVID or things like that, would medicine be available to them as well, especially for that person that has COVID but is sent home to quarantine because the
Sure.
symptoms are not bad enough for them to be hospitalized? So how would medicine be readily available to them?
Just let's make sure we all keep in mind. I've worked in the underserved community for at least the last 6 years. And one of the things that are always available in every county, in even the worst off states, is your community health center. Okay. I worked in North Carolina, South Carolina, Georgia, and mostly in community health centers. They do not charge for your medications. A lot of them have pharmacies of their own. A lot of them work on a sliding fee scale based on your income. So don't shy away from at least asking the question. Okay. We all have a health department. If we're just talking about COVID, your health department will take care of you from start to finish, medication wise, right? They might not be able to take care of your background, underlying issues. That's where your county health department comes into play. But I've seen some wonderful things happen in those communities, and but people don't take advantages of those resources.
Thank you so much. Thank you. You gave us a plethora of
Sure.
information. And I'm sure. Now, can you please make sure that you leave some of that information in the
Sure,
chat as well so that it can be
definitely,
distributed amongst other feeds? Thank you so much.
definitely.
Amen. So the next question I have, I want to direct it to Pastor Njeri Kamari. Now, make sure I got it right. They made a mistake and put Reverend on the flyer, and she called me late at night and let me have it. I've never gone by Reverend in all my years. So I want to make sure that I get your name right. Someone that I've known for a long time and is very dear to me, Pastor Njeri Kamari. So we know that your ministry is built around holistic living, positive thinking, things of that nature. I want you to speak to how, or piggyback on what Pastor Valerie Oliver was saying about keeping your mind. It's easy to cultivate negative thoughts during a pandemic, during a time where it's just uncertainty and we're unsure. So I want you to give us some advice. Most people don't automatically go to a positive frame of mind. Most people, we do dwell in the what ifs, and we somewhere teeter around the what's the worst that could happen before we factor in what can go right. We look at what can go wrong. So positive thinking doesn't naturally come to many people. So I want you to talk a little bit about that, how just thinking positive and changing your mindset and giving yourself positive messages can also have an effect on your health and your body. And then I want you to also talk about some things, some natural remedies that we can put in our diets, or even things such as aromatherapies and meditation and things that can help us, because I believe that those can be tools that can help us mentally and physically. So can you speak a little bit to that for us?
Sure. Well, let me first start with the first question around positive thinking. Positive thinking comes from within, just understanding who you are. One of the practices I've had for years, and I say it every single day, is that I am healthy, I am healed, and I am whole. I repeat that every single day. I believe the more you repeat something and the more repetition you have with anything, the better you get at it. Your appetite becomes such that if you're saying positive words enough, you will eventually begin to speak them wherever you are, not just to yourselves in the mirror, but when you're out in the public as well. Our mind has to be changed during this time. This is the perfect time, like Dr. Oliver said, for us to sit with ourselves, sit with our spirit, sit with the questions that you've had over the years. Throw all of that out of the window and become present with what you have going on today. For instance, you all mentioned parents working with children and the pressure. I say to anyone, put some music on. Music is the best way to get movement. Children love movement. When you can't figure out what to tell them when it's time for school or when they're doing their work, put music on, and music will elevate your vibration. And once your vibration is elevated, guess what? You will find that you all will find yourselves in some joy, some laughter, some movement. The other thing I suggest is that, and I tell people that come to my classes, that anything you attach what you're claiming to be in any given day. You can wake up in the morning and say, I am hurting, I am in pain, I am disgusted, I am afraid, I am scared, I don't know what's going to happen. Or you can wake up in the morning and say that I am love, I am joy, I am peace, I am grace, I am mercy. We have the ability within our spirit to speak positive about any situation, even some of the worst situations in our lives. Don't get me wrong. I know that people have people that are leaving this earth quickly. There are people that can't even say that goodbye to their loved ones. There are those who are parents who are stressing because they have children at home and they need to feed them every day. But there is a God in you that is greater than any COVID-19. There's a God in you that is greater than any situation you find yourself in. There is a God in you that is greater than diabetes. You do not have to beat yourself and die in this day and time because of what's going on around you. But you have to decide that you're going to live through what's going on around you. My practice is I burn candles. As far as that's a personal choice. Everyone likes different fragrances, but it's important to have them around you. I am a patchouli girl. I like earth tones. I love being able to burn incense and burn my candles and my oils. And I say what happens with that, it elevates my vibration. If you are operating on a low vibrational level, you will walk in fear, not faith. You will be find yourself depressed instead of determined. And what I mean by low vibrational, it means that your chakras are just so low because of what you're speaking out of your mouth. You can start today being in the present moment. In this present moment, you can say everything is well. In this present moment, you're on Zoom, if you're listening to us on Facebook. In this present moment, you've had a good meal to eat. Be thankful for that one meal. It may have been a banana. Be thankful for that banana. In the attitude of gratitude, we will find that the spirit then connects to that enjoyment, that joy that you have. Just because we're saying those positive words, then the spirit says, I line up now with you and your body. You can even teach your body to not be in pain when you stomp your toe or hit something. You can decide, oh no, my mind, I'm not going to let that stop my day. Yes, your toe hit, but unless you thought it was hurting, it's not hurting. You thought the pain before the pain came. So it is imperative that we have changed minds, that we change how we think during this time. This avatar that the spirit lives in is not, the body is a spirit of light, love, grace, mercy, peace, and joy that is waiting to time. Don't look at your past, what happened yesterday. Don't try to figure out tomorrow. Focus on right now. And in your right now, you can create a better life. You can create a better understanding. You can create some joy around your situations.
Thank you for that. And that's very good information to stay present and stay in the now, because most of our stress and anxiety is centered around, like I said in the beginning, the what ifs and the what coulds. But we actually only have to deal with our now, because tomorrow is not promised and yesterday is an illusion. We can't go back to doing about it. So I want to ask you, herbal therapy. I know that you do a lot around herbal therapy and lotions and oils and things like that. Is there anything that you could suggest that may help people with anxiety or help people, sleep? A lot of people are not sleeping. Are there any suggestions that you can give us around herbal therapy?
Well, I will tell you the scent of lavender is a wonderful scent to have in your home. It's a very peaceful scent. Candles and oils, you can get those. Also, I have shea butter products. I actually wear scented shea on my own body that allows me to be able to be surrounded around some form of herbal therapy. And then I use sage. It's an old Indian practice. A lot of people say, oh, that's the ward out evil. No, I believe that sage allows us to build up once again, your mind to open up and to be able to be connected to your spirit more. And I just suggest that whatever it is that you find, whatever fragrances that you find, because one thing about it, once I started selling shea butter, I noticed that every person had a different scent. But if you, once again, I'm going to go back to your spirit, because spirit knows what spirit likes. Your spirit knows you love the smell of rose. Your spirit may know that you love the smell of jasmine. The other spirit may know. Spirit knows. You'll be able to say, oh, I love the smell of cinnamon. Well, that's that's a smell that you ought to be smelling on a regular, because that's your spirit smell of this. That's your spirit speaking to you around that. And so the practice of aromatherapy is also connected to your personhood based on what your personal likes and dislikes are. But it is important to open up your senses to smell, because it allows you to remove your mind and your thinking to what's going around. Rosebush, you're going to smell it, and instantly it's going to change what you were thinking, because you can't help but smell that rose bush. You understand what I'm saying?
Thank you.
And
Yes,
so,
that makes a lot of sense.
during this time, you guys, while everyone is going through their stresses, during this time while you're going through people are going through whatever stressors they may be going through, you must be a situation in your life because of the life and love and light in you. Trust the spirit in you. If you spend every day just saying thank you, God, for that, I is doing. You know why? Because every one of your enemies made you better. Every one of your enemies did what they did, not to you, but they. This is a good time to practice spiritual
Yes.
meditation. And anybody that you have not forgiven.
That's a good point you're making. You're breaking up a little bit
right now. Anything and anybody, when I tell you unforgiveness will make you.
We're experiencing some technical difficulties with Pastor Jerry. So we're gonna try to come back to her.
You can't hear me?
Yeah, you're going in and out really bad, but I did catch a couple of things that you said. Now would be a good time to practice spiritual distancing. And then you also talked a little bit about forgiveness and letting go of oughts, because that can also attribute to sickness and things in your body. And so those are some really great points. I want to try to circle back around to Pastor Njeri. Yeah, we're breaking up really bad. So we're going to move on to, I want to speak to Tonya Hatton, and then we'll get back to Pastor Njeri, because she was bringing up some really great points. Pastor Tonya Hatton, I know that you do a lot of work with millennials and youth and young adults. And, you know, one of the key weaponry that we have is social distancing. That as our arsenal in fighting this coronavirus. You know, this practice of social distancing, because it helps us to measure the number of contacts, you know, the number of people that we have been involved with. It helps us to track. If we get coronavirus, it helps us to be able to track and say, I know where I got it. You know, it is one of the great weapons that we can use. But what we're finding, Pastor Tonya, is that our young people don't seem to want to follow the guidelines of social distancing. You know, time and time again, we've been seeing in the media where there was a rapper that had a party, and his theme for his party was Corona Palooza. You know, and it was filled with strippers and all types of things. You know, then we had this weekend in Atlanta at Gresham Park, there was over 2,000 people, young people in the park. There was a place in Chicago, they had a house party that I believe that housed over 1,000 something young people. And time again, we're seeing these young people gathering. And I do understand that that's a big part of being young, especially in African American culture, because we do like to fellowship. We like to gather. We like to gather around food. We like to gather around worship. We like to gather, you know, that's who we are as a people. But how can we convince them that this is not a time for being stupid? you know, um, somebody asked me, are you able to articulate things? I'm very able to articulate well, but some things don't need articulation. Some things you just need to say real, be real with. And and so how do we convince them that this is not a time to be stupid? This is a time to act responsibly, because I believe they're looking at it through a lens that, the early reports is that it doesn't really affect young people. And that they have the immune system to be able to fight this thing off. But what they don't understand is that they act as carriers, and they can carry this virus back into their families and their grandparents and back into the community. So what is it that we can do? Because clearly the government mindset is around, let's open this economy back up and get back to work. So we can't depend on them to send any messages or to start any type of campaigns, to help convince these young people they need to stay home and not be in groups that, well, they said don't gather in groups larger than 10, or they need to practice social distancing and wear a mask. What is this driving force that would cause them to sabotage themselves almost with no regard to their health or others?
Well, unfortunately, it's counterintuitive. We have a couple of things that are happening here. And I know my other practitioners I work with, young adults, can attest to this. There's a couple of things that is happening with young people. For one, they lack the developmental process of being able to understand the true consequences for their actions. They haven't formulated, honestly, in their brain that part that functions long-term consequences for their immediate gratification. So there's a disconnect with them being able to realize me going out and getting lit, me going out and hanging out, me going out to this cookout or this house party or whatever can affect the people that I care about, and not just myself. The other thing is that early reports and still indications are still spreading the message that young people are not being impacted as far as health-wise, that older people are people that have comorbid diseases as well. And then you also have, the government that said early on, or I should say the administration that said early on that this is a hoax. Then you have the government that's trying to open it up. So there's a lot of mixed messages that are going on. And then you're talking about a generation that relies on social media. Ms. Oliver brought up a great point. Go to these trusted websites like the CDC and the WHO for informed information. Young people are not going to go to that site. Young people are going to go to TikTok. They're going to go to Instagram. They're going to go to those type of sources. They're going to go to their friends and their peers for informed information. And as we know, those are not going to be reliable sources. So if we want to reach them, if we want to give them two messages that is going to be informative, that's going to give them information that's going to help them make better informed decisions, then we have to meet them where they're at. I like what I think it's Governor of Chicago did. And she did a cute little video about graduation Chicago. And she did a video on TikTok telling them that there's going to be an online graduation, celebrating the graduates of 2021, and that Oprah Winfrey is going to do the graduation for them. But she went to a medium that was going to reach the population that she wanted the message to go to. So we can't expect for them to understand what's going on if we're not going to be willing to meet them in the avenue that they're going to hear it in. So I suggest that if we want them to understand, that we start creating messaging and advertisement in the format that's going to work for them. Start using TikTok, start using Instagram, start using that other type of format that they're going to start, that they are on, versus seeing in a newspaper and those type of things, because they're not going to do that. The other thing too is start using one another as well. I'm pretty sure that those people that were out and about have family members that are informed, that are at the house when they come back, that can tell them before they go out to be mindful of the decisions that they make, and that they are being more impactful. We're not just doing enough in our own community. I've always been the type of person that says that we always want to say that the man is doing this. And yeah, I do understand that there are institutional things in place that work against us. But I do also believe that in our community, we don't do enough policing our own community. And so this is time for us to step up and do more.
That's good. That's good. Thank you. So what types of campaigns? I do like that about TikTok, because, the strangest thing to me is that, before coronavirus, we could hardly get our young folks to go outside, period. They lived on social media, and technology and things like that. But now they want to just go out and just gather by, the droves. There is an underlying sense of age appropriate rebellion that exists as well. Someone just asked a question, and listen, I want you all to think of these questions, because I'm going to open it up where you can ask the panelists questions, and just make sure that you know which panelist you want to direct your question to. But they just asked a very important question. Could anyone speak to, we've been hearing about young people having heart attacks and strokes. That has been their side effect to this Corona-19. And so maybe if we, make sure that they understand that, yes, you are affected. It just shows up differently in you and in your generation. So I want to ask if Kwinda is still on the line. I want to ask Kwinda if she could speak to that a little bit. Why is it showing up in our young people in strokes and heart attacks and things like that?
I think that, of course, there is the issue of sedentary lifestyle and weight issues and issues with unattended blood pressure. But it always amazes me when one of us comes into a clinic and we don't have a way to have our blood pressure under control. We in the medical community beat hypertension 30 years ago. You gotta take your medicines. Also, you've got to try to eat less salt. You have to walk at least once a day for 15 minutes. You can build yourself up. You can prepare your body for situations like this, meaning try as hard as you can to protect yourself from heart disease and high blood pressure. And so, again, I always go back to the issue of time. People for many, many years, keep telling me they don't have time. Now you have time. Go for several walks a day. Okay? Yeah. Keep your mask around your neck. You don't have to wear it while you're walking. You can take that off. But I think that has happened because of the sedentary component. A lot of us work very physical jobs, and now if you sit down, I've seen it many, many times. People get laid off, and 6 months later, they've gained 40 pounds. You can almost write it in a book. If you're not moving around just in your regular life, let alone making time for exercise, you're going to gain weight, and this is going to lead to hypertension, blood pressure. Know the signs. If your legs start swelling up, that's not normal. Okay. If you notice that you're having headaches every day, that's not normal. The hypertension, which leads to strokes and heart attacks, as does diabetes, they're very quiet until the problem is big. But we all know.
Well, in our young people, I don't mean to cut in, but now our young people, oftentimes we do know with our young people that we have seen an onset of obesity among young people.
Tremendous.
And we do know that a lot of that is directly related to technology and social media and things. I've been in my neighborhood for maybe 12, 13, maybe 15 years, and I've yet to see a child outside riding a bike, on skates, or doing anything like that. And I know that there are children in the neighborhood, but they just don't go outside and play. But as I said, it's so oxymoronic now that they want to be out, and especially we're talking about our teens and our our young adults, as far as maybe 14 to 24, that age range. They're having these large gatherings, and they're not going essential places, but in their lives and in their minds, these things are essential because our children are very social. They like socialization is the biggest thing for them.
Well, even before this coronavirus situation, the average parent spent the studies say about 12 minutes of face-to-face time with their child. So we got to really emphasize positivity as opposed to just being on that computer. computer. You've got to let them, you've got to introduce them to our mother nature. She is awesome. She will save you from all of these things. So I think that we have to emphasize, if a bug gets on you, it's okay. You know what I mean? If you get a mosquito bite, it's okay. If you see a spider, it's okay. Go outside. We have to let people realize how wonderful that is. And I don't know how to make people push that, but realize that it can save you from all of these things. It really can.
Oh, yeah. Yeah. You know, when we were growing up, we couldn't tell our parents we were bored because the first thing they would say was go outside and find something to do. And we found
Yes.
something to do.
Yes.
You know, and nature sometimes was our playground. So
Right.
thank you for that. And I want to go back to Tonya, Pastor Tonya Hatton, really fast, because there is a great concern. How can a parent, you know, we don't want to be the kind of parent that says, well, look, if you leave here, don't come back, 'cause you're not bringing germs back in my house. You know, we don't want to be that person. But what are some things that parents can do to kind of convince their children and help the children to understand first how serious this is, and then to kind of not enforce rules, but maybe enforce some rules for their households?
I've always been the type of person where, you probably tend to do a little more damage than being that type of parent. However, .com, I think that this is the time to do that. And the reason why I say that is because, especially in our community, this coronavirus is just that serious. The consequences and ramifications are just that serious. That you may have to be like, hey, look, if you leave, don't come back. It may have to get to that point. Because when I was looking at just the number of videos and parties and gatherings, and then when I looked at the color of the individuals at these parties and galleries and gatherings, that was more concerning and alarming to me. And the disparity that already exists, and now we are confounding that by putting ourselves in harm's way. We are only more perpetuating an increase in our own community. So at this juncture, we can't no longer afford to do it in a nice way. We're going to have to be more hard. Like, if you leave, don't come back. You can't come back in my health, because at some point in time you may have to maybe at this point you have to protect yourself. Now, on the other side of that, it may be even beneficial to start having more of a conversation. I think Dr. Johnson or Ms. Johnson brought up a great point. And one of the things that we're talking about, young people going out and gathering, we have to realize what has taken place, okay? Well, they went from being in school, being around their friends, socializing, whether it's social media in person, being able to do these things, to absolutely nothing. They are at home, taking classes online. They can't go to the mall, they can't go to the movies, they can't go out to eat. None of these things that they used to be able to do. So now their total life, the way they interact, the way they see the world has totally changed for them. And so we're asking them to now recondition all the things that they knew overnight. And we're talking about young adults. Now we think back to when we were teenagers, our young adults, just doing average things like taking out the trash was a challenge, and so it's going to be a major challenge for them as well. So we're going to have to exercise patience. We're going to have to exercise grace, and yes, we're going to have to do the things that are going to be necessary. And I saw someone on Facebook say that they don't believe the social media is going to work. I challenge that. I remember when I was growing up, one of the biggest campaigns that made an impression on me was Rock the Vote campaign. I still remember that to this day. They had T-shirts, they had famous people on, but they used the things that they knew would work for my generation. This generation, the things that work for them is social media. They are always constantly on their phone. They are constantly looking at YouTube. They are constantly on TikTok. You're going to have to use these platforms to create things that are entertaining and informative at the same time, to tell them what is really going on, how their actions will affect them as well, and the people that they care about, in order for them to make a better decision. And yes, their families and loved ones are going to have to be more intentional about saying, hey, look, you cannot leave here. Or if you do leave here, You need to wear a mask, you need to wash your hands, and you need to practice social distancing. And this is how you do it.
Thank you. It seems that our community has to have more prep talks before our kids leave the house. There's always a talk we got to give them.
Yeah, but you know what? But it's no different than, you know, our community. And if I'm honest, our community lacks having a lot of talks. We don't like to talk about sex. We don't like to talk about drugs. If someone mentioned it, Ms. Oliver mentioned before, we don't like to talk about those secrets. It's a lot of things we're going to have to start changing and we're going to have conversations about, you know, and so we need to start doing that now. And this is just another example of the conversations we don't have.
You're right. Thank you. Thank you. Thank you. Thank you. Well, I hope this is helping somebody. Powerful conversation going on. So I want to, the last but not least, I want to bring into the conversation Keisha Waites. And the question I have for you, Keisha Waites, is there's a saying, I'm not sure, I believe it's Dr. King, but I'm not exactly sure who said it, but it says when America catches a cold, the African American community catches pneumonia. And so that speaks to a lot of the systematic injustice and inequality and the disparities and the things that happen to us at disproportionate numbers and all of those. And there are some underlying issues as to why we catch pneumonia when everyone else just has a cold. And as I stated earlier, when their cold gets better, then they wrap it up and open everything back up, and we're left holding the bag trying to figure it out for ourselves. And so I just want you to speak a little bit to as to why that is, and what can we as the African American community begin to do so that we can start fighting, knowing what to fight and knowing how to fight those injustices that puts us at a disadvantage when it comes to these world issues that happen, or just the issues that happen in our nation or in the South. What are some things that we can start to do as a people to start protecting ourselves and educating ourselves around these disparities?
Well, I think a lot of that's already been highlighted this evening. You talked about the lack of access to healthcare. We've talked about the mismessaging, the misinformation that has happened at the federal level of government. We've talked about stigma and shame. We've talked about the dynamic of poverty. I would say homelessness and mental illness plays a major role as well. The other piece is that we had a number of people who were employed and underemployed. So we also live in a society where you have a number of people who go to work sick, meaning they simply cannot afford to not go to work. And, you know, even though in our society, that's kind of an undercurrent and we don't talk about it, but that is the reality. A number of people knew they had symptoms. A number of people knew that they were ill and got on a plane to feed their families. And I'm talking about from the higher levels of society to the lower levels of society. So this is just not an economic issue. We're talking about executives who kept working knowing that they were ill, taking Ubers, traveling on planes, knowing that they were not feeling well. I want to take this moment to particularly speak to how grateful and proud I am of Mayor Bottoms. I am extremely proud of the leadership that she has demonstrated. In fact, it appears to me in Georgia, in our state, that many of the businesses, bipartisan, regardless of party, regardless of race, seem to be taking their cue from the mayor of Atlanta to shelter in place and not open their businesses and to delay. So one, I'm particularly excited about that, but you asked the question, what is the solution? And so I want to just offer some thoughts. And I think the clinicians tonight have already talked about that. I think Pastor and Jury did a great job of talking about holistic healthcare, eating healthy, taking care of yourself. I am someone that deals with high blood pressure. I can tell you now at 47, this is the first time in my life that I've started to cook meals and prepare my own food. So I think that that's the start, is to cook, to prepare your own food, eating healthy. But I also think you guys highlighted a number of things that are happening, and we simply have to use good judgment. and common sense. I think that there's a lack of that. The other piece is that we've got to hold decision makers accountable. And I'm not going to politicize this conversation tonight, but I do believe that we have to hold the folks accountable who are making decisions that directly impact our communities. And lastly, I believe that COVID-19 has presented a unique opportunity in our community to talk about healthcare disparities, to talk about the fact that individuals have a lack of access to healthcare. I think this is a time, and I think that that's something that we can address at the federal level. And I think who you decide as your next commander in chief will directly impact that conversation. And so I think that there's an opportunity to harness a great deal of political power. I think that there's a huge level of depression, and I'm so grateful to be a part of a faith community where, you know, I am encouraged and nurtured. I mean, Bishop, you and I have a personal relationship. And so I think that's important. But I also heard tonight that, you know, the number of folks who are dealing with domestic violence. I think that the LGBTQ community is already strained due to some of those relationships. And so when you add on high blood pressure, diabetes, HIV, asthma, I think this is a no-brainer. So I think we're very clear about what those challenges are, in addition to environmental. Oftentimes our communities tend to be the least healthy. They tend to put waste containers and environmentally dangerous, impactful things in communities of color. And so with that, I think we have a unique opportunity is to talk about what it is that we want to see. I can tell you, Bishop, I indicated to you that my sibling, my sister, had the virus. Mm-hmm. And we made the decision for her to come to my home versus going to my mother's home, who was in her 70s and caring for 2 small children. I can tell you that daily, and let me be clear, I am not a physician. I am not saying go out and do any of these things, but I personally have used fresh ginger tea every single day. I am on black seed oil every single day because I am very clear that I have been exposed to this virus. And so with that said, that I've been very blessed, been very fortunate. And so I can tell you that there are some symptoms that I have felt, but I have not experienced some of the things that others have experienced. But in lieu of time, I wanted to simply say thank you for organizing tonight. Thank you for this conversation. It is my hope that this conversation will continue. I know Bishop and the rest of you guys, you know, we already started this conversation last fall in terms of bringing community leaders and folks together to talk about hard things. And tonight you guys highlighted the fact that we just don't talk about these types of things. And so I see a unique opportunity where we can get back together to talk about underemployment, where we can talk about lack of access to healthcare. We need to talk about the fact that folks don't have life insurance. This is the time to have those conversations. I got a call at 11 a.m. this morning that my mentor had transitioned 6 weeks ago. Nobody even knew it. And I'm sure that all of you guys are getting these calls as well. And so here's the thing, you know, you said that when America catches a cold, we have pneumonia. I mean, the reality is, I mean, I use the word Ebola. And so I think that this presents a unique opportunity in our communities for those ones who are not taking this serious, who are not sheltering in place. I'm not sure what else that we can say, but what we can do is for those of us who are taking this serious is use good judgment and common sense. And I simply am grateful for the conversation tonight, and I look forward to working with all of you to figure out how we can protect marginalized communities, communities of color, LGBT communities, senior citizens, and people who live in extreme poverty.
I'm not going to let you back out that easily. I have a question for you because I heard you say you didn't want to politicize the conversation, but we cannot not politicize this conversation. And as a person who has worked in government for, I believe you've been in government over 20 something years, we are at a loss. We clearly understand that the president is at a loss as to how to even begin to scratch the surface of reining this problem in, this coronavirus in. He has given so much bad information and so much misleading information. And then we bring it to our states. A lot of our governors are taking their leads, especially in the South, because there's a lot of red states. And a lot of our governors are taking their leads from the president and they're making these awful decisions. And you know the situation in Georgia. You know, a lot of people are upset about the decision Governor Kemp has made to just totally open the state. And then today, I believe the shelter in place mandate has expired. What is going on politically with this? I mean, clearly we need to just listen to the science. But what do you do when the federal government, when the government does not listen to the science, and it leaves African American people further at risk? And I do understand that, you know, now is the time to understand how important voting is, how important voting on the local level is, and things of that nature. But who do we need to talk to? Who do we hand the petition to? What is it that we can rally together to do as a community, to kind of get a hold, a grip, to get people to understand our despair, to get people to see us and how this is impacting us? Because to make a decision to open a state when your citizens, your African-American citizens who are very much a part of the workforce, who pay taxes and who do all of those things, are overlooked, and you can just say, open the state back up, knowing that those people are being affected the worst. How do we, I mean, what do we do politically? Where do we go? How do we start?
Well, yeah, I think it's unproductive to highlight the challenges that our existing president and our existing governor have. I think we know what they are. We talked a lot about common sense and good judgment. But what I will say to you is this. I find it interesting that although we have now reopened the state of Georgia, your state capital is not open. The state facilities are not open. And so again, you have to pay attention. The General Assembly is not in. In fact, they're debating when they go back in session.
Right.
If the decision makers have made the decision to protect themselves and to not show up, I think we have to exercise common sense to make decisions for our own community. But this is nothing new. We can go back to Tuskegee Airmen. We can go back to experiments that have happened in this country. We can go back to what happened to the Indians in the United States on American soil. So what we're saying is history often repeats itself. But the reality is this: what can we do? Exactly what we're doing now. Disseminate the correct information. Have people on the line who are actually informed, have compassion and common sense to exercise that. And again, I can't speak enough, not because she's my namesake, but I can't speak enough about Mayor Bottoms and the fact that she has consistently, because she did this at a time when it wasn't popular. She was one of the first governors in the country, here we go. She was one of the first mayors in the country to say, we shouldn't be doing this at a time when it was not popular. So the reality is this: absentee ballots have been mailed to most people in the state of Georgia. We have some serious decisions to make from the top all the way down to the bottom. So the other piece is I think we need to hold our decision makers and elected officials accountable. And I believe that when you look at the numbers of people that are requesting absentee ballots, I think that's getting ready to happen. And I think that we know that's going to happen at the federal level. And the last thing I would simply say to you, Bishop, is, taking the time to organize. We can be doing a lot of things on a Friday night, but I don't think there's any conversation more important than how we protect the lives of our community. And so for the 6, 7 of you who are on this panel tonight, I applaud you. I am grateful to be a part of this conversation. I will always make myself available to figure out how we can find solutions to some of our problems. And I think this is an ongoing conversation. I think that this is probably going to be a long overhaul. I don't think this is going to be a 90-day or a year conversation. I don't believe that we will ever go back to life as normal, ever. Right. And so I think we live in a different world. But again, this presents a unique opportunity. And here's the thing: we have to have conversations about health insurance. We have to have conversations about life insurance. We have to talk about things that are difficult. And I think that COVID-19 has presented an opportunity for us to do that. I can tell you that, my sibling and I, we have little spats from time to time and disagreements. I can tell you that Right now, we're picking up the phone, checking in, regardless of how we feel. I'm still mad at you, but hey, how you doing? How you feeling today? Same thing. I am delivering groceries to my mother every single week. She has made the decision to not let me in. They get dropped off at the porch, and I keep it moving. But the reality is that for everybody's family, it looks different. You know, I'm a pet owner, so you know, I don't let my pets lick me in my face. There's certain things that just I don't do anymore that I used to do on a daily basis. And so life is very, very different for all of us. And I think that we will survive this. I think as people of color, I think we've survived. I mean, we've been in the bottom of the ship. So certainly we can survive this. And I think it's going to involve using our intelligence. I think it's going to involve, and here's one more thing I want to say before we part. You know, this whole notion that young people cannot go outside, this whole notion that you're not going to be able to attend your graduation. When you are looking down at someone you love, and it is a final conversation, and it is over, this is the last one until we all meet again in heaven, I think that changes the dynamic. So this whole piece about, you know, oh, you know, I'm bored, you know, my niece and my nephew, they're losing their minds. The reality is that we have had to deal with this young generation. And I think it is time that we rein them in and have very difficult, painful conversations. Sometimes, like the mother said, you got to sit down somewhere, because the reality is the decisions that you're making today will end your life. It will end your life. And so, you know, if I can cook for the first time at 47 years of age, you can just kind of find you a Netflix movie to watch. And so this is not fun. I mean, I'm not excited about this. You know, having a sibling that is ill was absolutely terrifying for my family. We were on pins and needles over here. And we are still dealing with this because it is not over. Every time we walk in Walmart, every time we pump gas, we don't know what that means. We don't know. And unfortunately, we live and we operate within a society and a government that's not honest and truthful. And that is frightening. So I think these conversations, this technology, our folks in the 60s didn't have Zoom where we can sit. We don't have to go to a meeting. If you can't give up an hour of your time every day or once a week, something is wrong.
Yes. Well, thank you so much. And you're right. We can all agree that this is a new normal. And I don't think, as you said, things will ever go back to the way they used to be. This has been an AC/DC splitting of time, AC/BC, AD/BC, Lord have mercy, it's been a splitting of time. And you're right, the veil has been ripped and there's been a lot of things exposed, and now we're very clear. Sometimes it takes tragedy to make us very clear about our place in society and where we are, how far we've come, and where we need to go. So I want to thank each of our panelists tonight for taking time out of your busy schedule. And if you would oblige me with maybe 15 more minutes, I want to open it up for questions. I've seen a lot of questions coming into the feed, and there's some great questions. I believe Pastor Devlin is on the line and monitoring those questions. So Pastor Devlin, if you see questions, and if you know who they're directed to, if you could lift those up at this time. Thank you so much for that, Keisha. We are praying for you, and we know that you are yet in another battle, vying for a seat in Congress, and I believe that our Congress needs your voice.
Yeah.
You've always been for the people.
Yeah.
And we thank God for you, and trust me, we're on your side. Another person I want to lift up too is Stacey Abrams. Thank God for her the Fair Fight Act with the vote, because now that we have these absentee ballots, we got to be sure that they're being counted, and she has put some very strategic things in place in this state to make sure that everybody's voice votes and voice is heard during the election. And so I thank God for the work that she is doing as well. So we're looking forward to seeing her in the White House. Amen. So Pastor Devlin, do you see any questions that you would like to read on behalf of whoever posted the question?
I am looking at the live feed now, waiting to see if any questions are going to come in. I believe you touched on the questions that were in the feed on the Zoom.
Okay.
So you touched on those questions, and now we're just looking at Facebook to see if any questions are going to come in.
Okay, if you have any questions, pressing questions, you can raise your hand, I believe, I'm still getting used to this technology thing too. But you can raise your hand and we will be able to unmute you and so that you can ask your question. Thank you all again. This has been some very powerful conversation, round table discussion, you know, where we just come to the table of reason and try to figure out how we can move forward together. And I just thank God for everything that was lifted up into this conversation on tonight.
I would like to, if I can,
oh yes,
I'd like to also remind us, one of the things that we did not mention a lot of is important that you drink a lot of water right now too. Make sure that you're drinking your water. Drinking tap water or water out of the bottle if you're drinking bottled water, or try not to do so much ice water. Try to drink your water at room temperature during this season. Drink warm teas during this season. The ginger is great, Keisha. Ginger, lemon, those things. Turmeric helps to bring down inflammation. We do alkaline water over here because it helps build up your pH level. And if your pH level is at a certain level, it helps fight sickness and dis-ease. And so if you have high blood pressure and other physical disparities, you know, if you can definitely reach out to me when we're off the Zoom about alkaline water. And then detoxify your system. This is a good time to clean your colon and your liver. Our colon and our liver contracts a lot based on the foods we're eating. And if you're eating foods that are packaged foods, then you're probably not having the correct amount of releases during the day. So water will allow you to release, and water will also help to clean the colon. And with that, you'll have clearer thinking. Because when your body is going through, of course, pain, and you're not having a regular bowel movements, and if your pH level is low, which means your energy level is low, then your thinking may be off. And so all of those things will also help you in creating positive attitudes with your thinking as well.
Awesome. Awesome. Alkaline water. Thank you for that. And tap water, I would say with a filter.
Yes, with the filter. But when I said tap, I really just meant about room temperature water, but definitely filter your water. Do not be drinking water at the sink if you don't have to. If you have to, drink your water, but if you don't have to, don't drink it straight out of the faucet. Try to do, but you know, for those of you who can possibly, you know, if you can get alkaline, we have a cart though where you put it into your own beverage. You don't have to buy it at the store where it's more expensive. And we'll talk to you. I can talk to you about that over the phone a little bit later if you want to. But definitely drink your water, you guys. Cut back on sodas, acidic beverages. All those things are the reasons we deal with the high blood pressures, the diabetes, and then of course, tell yourself you're not gonna worry about this, because worrying about it is not gonna change it. That's a fact.
None of us should drink juice or
Decide
soda.
that those of you are listening, that you're not going to worry about this particular. Yes, we have to be active. Yes, Keisha, we have to go forward and begin to challenge those who are in leadership. But we, on a personal level, when you spend time with yourself, self-talk, positive affirmations. I have an affirmation that I do that I say, I am amazing through and through. I made it up on my own. I am amazing. How about you? Because I am. And I promise, the more you do these things on a day-to-day basis, the better you'll feel about yourself and the less stress you'll have about what's going on around you, which allows you to be more proactive with the things that you are here to do.
Amen. Thank you. Thank you.
Bishop.
Yes.
Ms. Millet, I would just like to add a little something to something else going on in our environment that I failed to mention, that there is an increase in alcohol consumption.
Oh, yeah.
And you know, in our neighborhoods, there is a liquor store, a little corner store with that sells nothing but fried chicken wings, alcohol, and cigarettes.
Mm-hmm.
No grocery stores, no produce sections, you know, alcohol, cigarettes, and beer. Okay, so people sometimes are using alcohol as a coping mechanism. I'm not saying something is wrong with drinking, you know, socializing or whatever, but to use it as a coping mechanism. Drugs, I'll just take a pill and go to sleep. I'll just, you know, smoke me some weed or whatever and just forget about it, you know. But the problem is still going to be there. And so, you know, especially when we're talking about our millennials and our young people, alcohol and drugs will not fix the problem. It makes the problem worse because now you're putting things in your body that's going to affect every organ in your system and it's going to affect mental health. Alcohol actually can increase depression and it can also increase your level of anxiety. So we just got to learn how to live with life without using drugs and alcohol as an escape mechanism. You know, and so that I meant to mention that earlier, and it slipped my mind. But people are drinking more now and doing more drugs, trying to cope with COVID-19.
Yes,
and that's just going to add to the problem.
Thank you, thank you. And you know, before COVID-19, we were in a society now where everyone's looking for a feeling. Everybody wants this orgasmic level of feeling. And so usually we turn to substances or people to get that feeling. And we want to stay on an orgasmic level, but you got to come down sometime and deal with reality. And so thank you for adding that piece to it. As we're seeing the onset of all of these designer drugs that our young people are doing, you know, mollies and all the things they have, it's because they're looking for a feeling, you know. And so thank you for sharing that piece. Thank you so much. And I'm going to ask if you would, you and Pastor and Jerry would also put some of your practices into the live feed so that people can take that information with them. I believe Pastor Marvetta Walker is on the line and she had a question.
Yes, I'm unmuting her now.
Okay.
Well, good evening. I mean, these are some awesome women of God, and I have enjoyed this thoroughly on a Friday night. You know, I have participated in all kind of Zoom meetings, you know, just relative to work, but I want to say to you that I am so appreciative of your expertise, your spirituality, and the wholeness. You know, it's something that we get away from when we think about the holistic care, you know, as a healthcare provider. And I listened to the other healthcare providers on here tonight. I just have to tell you, I'm just thoroughly proud that we have these Black women that are doing great things. And I just want to say thank you so much. And I was busy, you know, chatting while you guys were talking. And I have to tell you, you addressed almost everything that I put down there on the chat. And so I thank you for taking time out of your busy schedules to just grace us with your presence. And I learned so much, and I am so appreciative. And I pray that we can do this not only when there's a COVID-19, but we have to do this on a regular basis so that we can, you know, look out for our people, you know, because we're underprivileged, we're underserved, we're underrepresented. And it's just like, okay, yeah, it's time. Time is up. And so thank you, ladies, for all that you're doing. I really do appreciate, you know, as I'm sitting out here on my patio, I'm just like, oh, wow, this is great on a Friday night. So that's all I want to say is thank you so much. I really do appreciate you.
Thank you, Pastor. Amen, amen. Thank you. Will there be another question before we?
We have someone on Facebook that wants to speak, and we're just trying to get their question in. So one moment.
Okay. And while they're trying to get that question together, I do want to pause to acknowledge our presiding prelate, Bishop Yvette Flunder. And I also want to acknowledge our regional bishop from this South region, Bishop Alex Byrd, who is now a senior bishop. And I just want to thank them for giving us space to be able to do these and hold these meetings. And we've been zooming up something in fellowship, I promise you. I think I've had a Zoom.
Amen.
Zoom. We have Zoom, I tell you, we done Zoom now. But yeah, and I thank God for each one of you panelists as well. It just means a lot because what you're doing, you know, you get paid to do what you just did. And so I thank God for you just volunteering your time. Thank you so much. Were we able to get that last question in?
No, I'm trying to get it now. It's from Carice Lofton. So I'm trying. She tried to join the live, but it won't let her in. So
okay, can she just put her question in the chat and you read it?
Yeah, that's what I'm trying to get her to do now. Okay.
All right. We'll give her opportunity. If there's anyone else while we're trying to get Carice Lofton's question in, if you have a question for one of these ladies and you want to directly ask them, please feel free. All you have to do is hit your raise my hand button and Devlin, moderator, will unmute you and you'll be able to ask your question. If you did receive that ballot, that your absentee ballot, make sure you get that in. Make sure I believe the polls are going to open in June for, I believe in Georgia. I'm not sure about other states, but you know, to avoid that while we're yet still trying to shelter in place. Because, you know, Dr. Fauci and Dr. Sanjay Gupta both said that this thing is going to go on to the end of the year and could possibly still be a factor to the beginning of next year. So, you know, we're just going to have to adjust to a new way of doing life and adjust to a new normal, unless God says something different. And we do know that God can intervene at any time and turn it around. But Proverbs does tell us that wisdom is our friend. And that wisdom will protect us. So we have to use wisdom as well. So were we able to get it? I don't want to tarry too long and hold everyone.
And be sure that we also doing our census, because it is imperative that you take the time to do the census. It takes no time to do it online or send it in the mail. One of the reasons our communities lack a lot of times in funding as well is because we are not accounted for. And the census is how that's done. Not to say that they're always doing with it all the things that it needs to be done, but at least if you do it, you know then that you're accounted for.
Thank you for that. Yes, we do want to make sure that we get those census turned in.
1 second. We have a raised hand from Bishop Alex Byrd.
Hey, Bishop Alex Byrd.
Bishop.
God bless you all. How are y'all doing?
Wonderful.
So glad you all were able to come and volunteer your time and give us this all-important information. Thank you so much, Bishop-elect Sonia Williams, for pulling all of these panelists together. And I'm sat here listening to all of the conversation. And I, like Pastor Marvetta said, that all of my questions, I just went down the line and started checking them off because y'all touched on a lot of them. I do want to ask the question because we're getting what's called a stimulus check from the government. And the stimulus check from the government is not meant to help you pay your bills, but the government is actually giving it to you so you can go and spend it and help this economy get back up and running. How can we as a community begin to utilize that stimulus money in a better way that fits, that helps our community get better than to always be the backs on which our economy is being raised?
Is Representative Keisha Waites still on the line?
Yes, she's there.
Can you hear me okay?
Yes, we can hear you.
Yeah.
It would probably be best to answer that
So
question.
I share that sentiment as well. I think that $1,200 is certainly not enough to cover the average family expenses. So I think there are a couple of things that we need to look at. One, for those families who have no income coming in whatsoever, certainly we have to use common sense to do some of the things that we need to do to take care of our families. But I also think, and Bishop, you and I have talked about this before, we've got to start having conversations about making better decisions. It is time to forego cable TV and to look into getting life insurance. It is time for us to have conversations about getting health insurance. It is time for us to have conversations about how we can make better choices in terms of our diets and our lifestyles. I think it is time for us to pause purchasing mega mansions and to start to look at things from a different perspective, like saving money. This is a good time because we don't know what's going to happen tomorrow. So I think right now we need to have some serious conversations about how we save our money. Right now, there's a level of instability. I think this is time for churches to start to talk about why we don't own banks. These are the very difficult, tough conversations. And I think with the organization of the affirming ministries and so forth, this is a time for us to come together as a whole to figure out how we can use some of these federal dollars to figure out how we can start to nurture our communities, buy buildings, own property, those types of things. And so I see a unique opportunity through COVID-19 for us to harness our political power, one, and two, harness our financial firepower in our various communities to figure out how we go to the next level.
Amen. And so can I piggyback, Bishop Byrd? I've heard that a lot of people saying that they're just saving the stimulus checks. And they said that hurts the economy when people save the stimulus checks versus go out and use it to stimulate the economy. And would this be a good time to support Black businesses, to get our dollars to circulate in our communities a few times, or is that a myth that it hurts the economy when we use those stimulus checks as savings?
I certainly think that it may, I don't think it hurts the economy. The economy is what it is. But I think that we should not be so concerned about the economy as we are our own health. We're making decisions oftentimes that are counterproductive for us, but is productive for the rest of the world, or for those that are in power, and for those who have what we need to have. And so I'm certainly not against going and spending it and propping up our own businesses. But what I am saying is that if we're going to use our finances, then let's really think about where that money is going. Let's really think about what is the interest, what is our own interest that we should be serving with the dollars that we have. And I always remind people that money is only economic power when you have it. And when you spend it, you give away your power. So, but I think we do need to look at more of our choices on how we're using our money to benefit ourselves and our communities.
Awesome. And I thank you for that. And I agree with that. We need to start getting our money.
I totally agree.
To our neighborhoods. And I want to piggyback on what Keisha said as well. Life insurance. Life insurance is a way that people have gotten generational wealth for years. Life insurance is not just about you being able to, be buried in a gold casket and have the horse and buggy. Amen. Life insurance is a way to pass something on to your family. It's a good way to have to leave generational wealth. And you can, if you buy a nice size policy for your children when they're very young, and pay minimal costs, by the time they're adults, they have some money that they can take out of that policy and invest in their own businesses. And also right now is a good time to be looking at the stock market as well. So those are just some tips. And GoFundMe.
And if you can,
GoFundMe is
if
not
you
like
cannot buy life insurance, buy burial insurance. If you cannot buy life insurance, get you some burial insurance.
Yes, yes.
We have a Facebook question. I believe this one was for Kwinda, but I don't see her. But I'm gonna, okay, there you go. I can ask it. This is from Deborah Rodriguez. She wanted to know, will it be all right being a type 2 diabetic and suffering from COPD to use holistic measures?
You can certainly seek holistic measures. There's absolutely nothing wrong with that. However, if you do, don't reject Western medicine. It can really be quite helpful, especially when it comes to lung disease and that type of thing. So you can incorporate both. You don't have to do either or. And if you're seeing a
Yes.
physician that doesn't want to talk to you about that, get another one. Okay, just dismiss them. If they don't want to talk to you about like if anybody ever introduces you to diabetes with a pill, they're wrong. You should change your diet. Just start walking more.
Diet.
Most
Yes.
most things that affect us physically can be addressed with our diet and exercise and changing
your
our
diet.
activities. We bring a lot of things upon ourselves in other areas of medicine as well. It's not just us, quote unquote, but look into the natural ways. You've got to use them. They help. If you're sleeping better, if you're drinking more water, if you're avoiding juice and soda, please, Black people, no juice or soda. Just don't even buy them. If you're taking in more vegetables, if you're walking more, if you're taking care of your spiritual life, you will be healthier. You will. That's a fact. That's a fact. You can take all the pills you want to. People think, oh, I have high cholesterol, just take the high cholesterol pill. No, you've got to stop drinking bacon juice every night. You can't have fat back in your greens. You've got to change how you approach this so that you don't have to be sick. We don't have to be sick. We just don't have to. My parents live right outside of Georgia, outside of Atlanta. They've always been vegetarians. They've always exercised on a daily basis. And other than them wearing a mask, I'm not worried because they've taken care of themselves. They've never drank. They've never smoked. They eat vegetarian. They exercise on a daily basis. I'm not worried about them. My dad keeps going to the grocery store, but I'm like, yeah, okay.
We have to be proactive and not reactive.
Right.
Yes.
Absolutely.
Well, thank you all. Thank you so much for this conversation. And it's so good when we can get together and talk about the things that concern us as a people. And I appreciate your transparency. I appreciate you being authentic and real. And you know, I look forward to part 2 of this conversation because clearly there's more questions that we need to have. And someone mentioned earlier repetitiveness. We got to repeat these things over and over and over until they become real.
Yes.
Yes. And so thank you all. Thank you so much. I don't know if y'all can see everybody, but I'm going to ask everyone to give you some hand claps right now. And so we will reschedule part 2 of the conversation. This has been so impactful. I'm going to ask Bishop Byrd, since he is still on the line, if he would please close us out with a word of prayer. Yes, I do too. Pastor Marvetta Walker says she looks forward to part 2 from this group of panelists, and I do too as well.
Absolutely.
Gracious God, we are grateful. We're so grateful for your love and your kindness. We're so grateful, God, that in the midst of what seems to be an upset of the whole world, God, you are giving us calm and peace. You are giving us the ability and the wherewithal to have these all-important conversations, to really begin to reconsider and to consider, oh God, the things that will make us better in this time. God, I thank you for these panelists that have given of their time, they're given of their ideas, They've given of themselves, oh God, in this conversation. Bless them, oh God. Bless them as they go back to wherever their areas of responsibility are. Give them the wisdom, oh God. Help them to tap into the wisdom of God on the inside of them and continue to create the change that will bring peace and unity in this world. And we bless God for all of the participants that are online, that are watching, that are listening. Oh God, in the name of Jesus, we pray that whatever has been said today will fall on good ground and that they will be able to implement the things that have been talked about today. It's in the name of Christ Jesus that we pray and we glorify your name. Amen. Amen.
Amen. Amen. I also want to thank our moderator for tonight, Pastor Devlin. Thank you for keeping us flowing and going. And also Pastor Tonya Hatton, thank you for helping us work out the kinks. So God bless you all. Have a wonderful night, and listen.
Thank you.
If you're on the line and you're looking for a place to worship, look for a fellowship church in your area. You are welcome. You are welcome. You are welcome. We would love to have you worship with us on Sunday. So God bless you, and y'all have a great and wonderful night.
God bless you all.
Night.
Thank you.
God bless you.